If you're interested in a career that puts you in direct contact with patients as their assessor, advocate, and caregiver, then nursing may be the career for you. The team at HaysMed has a look at the critical role nurses serve in the healthcare industry.
I've been a nurse for 33 years. I started as a CNA, and during the time that I was a CNA and going to school, I realized that nursing is the profession that actually spends time with a patient. And I felt that was very important. So I wanted to make sure that I devoted my career to actually spending time with patients and helping to influence their health outcomes. One of the reasons to choose nursing is because you can be anything you want to be. Most of us will start, like I started on med-surg, but then you see everybody go from there to something else. You can be anything that you want. You can work in a clinic, you can work in the home setting, you can work in the hospital, you can work everywhere from birth to death. You can be an adrenaline junkie and love critical care, or you can be somebody who wants to make sure that you see the outcome, not just the care that's delivered in the moment, but what's the outcome of that? And you see people go into that, go into long-term care, go into things that you're going to have that patient for a long period of time, not just 5-10 minutes or 5 or 10 hours.
I'm in the float pool, so I work on all types of units from the med-surg to the critical care side and sometimes some of the outpatient units. So I feel like I can interact and impact a lot of different patients in many different ways. My typical day usually starts, our shift starts at 7 o'clock in the morning. That's our official time. Usually get here about 6:30, 6:40 in the morning, start getting a report. Once we're done with report, I typically go and research my patients, look up everything up in the computer, and then I go start getting my medications ready and go start assessing my patients. Each day is very different. In nursing, we always joke that it's so hard to plan your day. Because you could have the perfect plan in writing. This is what I'm going to do now, then this, then that, but then something happens and your plan is out the door. That's also one of the great things too, is that you're not doing the same thing over and over. It's not repetitive. You're doing many different things each day.
I've been working on the acute care unit for about 2 years now. The bond and relationships that I have made on that floor is absolutely amazing. We have great teamwork, whether it's between just the PCTs and I, the nurses and I, even the doctors. The doctors are great, especially the hospitalists. The most rewarding part about the nursing profession is that you don't know what the day-to-day will bring you. There are days where I don't get to sit down because I'm giving baths, I'm changing bed linens, I'm providing all these cares that are right there. And then there's other days where I get to just sit one-on-one with a patient who isn't themselves at that moment, so you just sit there and you listen to them, you listen to their stories, you play cards with them. Most people who come to the hospital are at their lowest points, so you have to just be their friend and form that relationship with them.
I enjoy the patients the most. The patients, I just love talking to them. I don't just talk to them about their disease processes. I actually get to know them as people. I see pictures of their grandkids. I see pictures of their children. I get to know them in the clinic setting as people and not just patients. So they become very close to me. When I get patient into a room, we check their vitals and I go over medication lists and any allergies that they may have, their reason for coming into the clinic, and going through the symptoms that they're experiencing for that day. If you have really strong communication skills, this is really a good fit for you, as communicating with your patients is very important, and knowing that you care about them is really important. It shows that you have compassion for what they are going through. A career in healthcare has a lot of flexibility, and as your life changes, you get married, you have children, just different things that happen in your life, you can always find a way with the different hours or different positions that it can accommodate to your lifestyle, and then you can achieve your goals still and maintain your family life and your work life.
That's another great thing about nursing is your schedule. we're required to work 3 12-hour shifts. Sometimes you can work those 3 days in a row, Monday, Tuesday, Wednesday. You're off, Thursday through Sunday. Some days you can work 1 day on, 1 day off, and just basically you can adjust it to whatever you have going outside of work. So it's very flexible. So that's a really unique thing about nursing or working in the hospital setting, is that it can be very flexible. Some weeks I have 5 or 6 days off in a row, and that's without me using vacation time. So I know sometimes people get very excited, people have office hours. Oh, we have a 3-day weekend. I have a lot of those.
If you don't know what you want to do, you're starting on the right course by being in this experience, to start to explore what is out there. And when you're exploring, make sure that you are paying attention. It's really easy not to pay attention, but pay attention. If you love science, pay attention, because these careers, and especially nursing, is heavily scientific. If you are a very caring person and you know that caring is your core, then take that and start to expound on it. Start to grow with it, but always pay attention to the science part. And then understand that where you start is not where you're gonna finish. I didn't start to be a nurse. I didn't start to be an administrator. In fact, my goal in life was to have a job that I never wore a tie, and that I never had to go to do public speaking. And now 2 things that I have to do a lot is wear a tie and public speaking, but that's because I was open to the opportunity. Always be open to the opportunity. Never be closed to what you are going to learn about.
I want to welcome our panel of nursing experts to answer your questions about the career opportunity in nursing. But first, please introduce yourselves and tell us what you do at HaysMed.
Good morning. My name is Terry Seek, and I'm the Vice President of Patient Care and Chief Nursing Officer.
Hi, I'm Barb. I am the nurse for the ENT clinic here at the hospital.
Hi, everyone. I'm Fernando Guzman. I'm a float nurse, registered nurse as well.
So, Fernando, let's start with you. One of the things that I learned in your video was that there are all different kinds of nurses, different levels. What are the different nursing levels? RN, LPN, APRN, CNA, and how are they different?
Yeah, you can categorize nursing into different levels, as you mentioned. The first step, becoming a nurse, or if you want to go that path, is becoming a CNA, which is a certified nursing assistant. From then, you can, depending on the path that you take, if you do an associate degree, you can become an LPN, licensed practical nurse. Or if you want to go a bachelor's route, you become an RN or a registered nurse, getting your BSN. And then if you want to pursue your career further, then that's when you're looking at an advanced degree, which would be like a nurse practitioner.
Well, that seems like a great path opportunity for anyone that has an interest in nursing to kind of maybe take it a little at a time and really carve out their niche.
Yes, it is. And you can kind of see what you like, or kind of see what path you want to take once you're doing actual nursing.
And I know we have lots of questions from students. So Jaron, it's all yours.
Yes, we have. This has been a hot topic in the chat and via email as well. Gotten lots of questions coming in. So we'll start the first one, kind of along what you were just mentioning, Fernando, this is from Caitlin in Beloit. What age can you become a nurse, specifically CNA, LPN, RN? And what advice would you give to students wanting to become a nurse?
I think as far as a CNA, it depends on the facilities, but I don't know if some of the nursing homes hire at 16. I don't know on that. But for the hospital setting, I think you have to be 18 years of age to get your CNA. But I know a lot of high schoolers start their path during high school with some of the allied health courses and start getting a step ahead and get their CNA while in high school.
Well, and so also next, coming from Elena out at Smith Center, she asks, what is your day-to-day schedule as a nurse, if there is a true day-to-day, but what does that kind of look like? And maybe also, what is the shift in terms of how many hours? What does that look like in a week?
Well, it varies. In nursing, we always joke, it's so hard to plan your day. You can have the perfect plan laid out, but by the end of the day or by noon, you're doing completely different things. So it's pretty hard to plan a day in nursing. But typically, I do 12-hour shifts. Our shifts start at 7 in the morning and end at 7 p.m. A lot of times they don't end at 7 p.m. because you're doing a lot of the computer work at the end of the shift. But in the morning, you start out with, getting a report from the night shift. I'm a day shifter, so I start by getting a report from the night shift. And then once that is done, I go research my patients, get a little more information on them. By 8:30, 9 o'clock in the morning, we start passing medications, and then we start collaborating with the doctors as to what else we need to do with each particular patient.
And on the clinic side, it's usually 8 to 5, Monday through Friday. And we start seeing patients at 8 o'clock, usually over the lunch hour. Most days we don't see patients. And then our last patient's usually at 4:30 to end the day at 5. So generally we try to get out of here around 5, but sometimes you have to finish things up.
And as Fernando alluded to, healthcare is 24/7. So you have night shift, evening shift, you have a lot of different hours. Plus, we have OR that's coming in at different hours and staying later and taking call. We have cath lab. So depending on where you want to be in nursing is going to dictate what your schedule is going to look like and also what your days.
Thank you all. And so another question from Ellie. She's wanting to know, can you explain the struggles and rewards of being a nurse?
I can say from on the clinic side, a lot of times is where sometimes you're diagnosing hard things and having to handle those things with patients and families. And so that's kind of a struggle. And then the rewarding part is patients are very thankful for the help that you give them, especially if you communicate well with them. They're just really appreciative. So I think the struggles are more of, the hardships that you have to see your patients go through. And then the rewards are when you meet their needs.
Go ahead.
On the inpatient side, we can go from one extreme to the other. Your struggles when you're dealing with very sick people, very sick patients. You're taking care of them. It's not just the patient that you're taking care of, but you're also taking care of the family as a whole. So that's kind of hard, just dealing with some of those family dynamics. On the other extreme, once your patients are much better, they're feeling well, you're discharging them at home, they're happy, they give you a hug at the end of the day. That's very rewarding.
And Liliana asks as well, so, and maybe this ties into struggles, and maybe this is some days more than others, but as a nurse, do you have time to spend with your families?
Yeah, I do. I level it out pretty good. And for me, being on the clinic side, which is why I do the clinic side, is to balance my family life and my work life. So for me, it works out well.
I agree. I love my nursing schedule. I do 12-hour shifts, 3 shifts a week, which means I'm off 4 days during the week to spend time with family or do whatever I need to get done around the house. So that is one thing that I really enjoy about nursing, is the flexible scheduling as well.
We have another question from Twyla, and so she is asking, obviously COVID happened the last couple of years. How has that changed your jobs and what you maybe have had to do on a daily basis, or maybe just some of those struggles during the pandemic as well?
On the clinic side and hospital-wide, of course, we were all wearing masks at all times. And we were calling and screening patients before they came to appointments, just to make sure they weren't having, with the clinic that I'm in, with the ENT clinic, we're a little different because we're a specialty clinic. So, if somebody was running a fever or having something that we're not going to be treating, we probably would reschedule them. So just things like that, screening patients and cleaning a lot more, wiping down, even our waiting rooms, and just lots of extra steps in keeping our patients safe.
And and what we did through the pandemic, as Barb said, some of that stuff continues, some doesn't. But the greatest thing about the pandemic was we saw that we changed as the evidence changed. And that's another thing about nursing. What you do every day is going to change based on what your patients have and what you are faced with and the challenges. So looking at the challenges as opportunities and being able to figure out how to take care of that patient in that new environment was really interesting for all of us.
And I'll throw one last question in the final minute or so that I think we have. So this is from Jenna. So she is asking, we've heard a little bit, there's the hospital nursing, there's clinic side nursing a little bit too, but are there also these specialties that you can also go into as a nurse? And maybe that's more after you kind of get your career started, but what could that look like in terms of that breadth of nursing that you're able to do?
Well, within the clinic or the hospital, you have a lot of different things you can do. You can specialize. We like to say that either you have a broad depth of knowledge or a wide width of knowledge, depending on where you're working. For some of our nurses, our ICU nurses, they're specialized in critical care. A med surg nurse is going to be more of a generalist. But also outside of those two traditional areas, you're looking at pharmacy reps and other things that nurses do, home health, hospice. So you're specializing down into one area. You never forget what your basics are, but you are becoming an expert in one area over another, and that expertise comes out.
Well, that was our last question. Thank you very much, the team from HaysMed, for spending your morning with us and sharing your insight on becoming a nurse.